Hello, this is Colleen Hernandez with CGI. We are here today to discuss the open enrollment benefits for Aker Kasten Home Health Care. Before we jump into the benefits, Matthew would like to take a few minutes to talk to everybody. Matthew?
Thank you, Colleen. I appreciate it. And hello, everyone. Hope you are having a wonderful day and/or week. I just wanted to first say thank you to Colleen and Jamie and Debbie and Kenny and the whole team at CGI. They every year fight for our best interest, and we appreciate that. And they've been a great teammate in putting together some good benefits for our staff members. So I just want to thank them for their great work. I think hopefully you as an employee of Aker Kasten Home Healthcare understand that year after year we are trying to give as much value to you as we can. There are many benefits out there that we have been talking about adding or wanting to add, and year after year we're trying to just improve upon what we have, and hopefully as time goes forward you'll continue to see a better and better benefit package coming your way. Insurance world is strange, and I'm glad I have Colleen and others to keep it balanced for us. So I really appreciate them, and hopefully you see the benefit of their work. I think a lot of you have seen that Colleen's a great resource for questions or things like that. If you run across confusing situations or issues, she's a champion for you. So she's always a great one to call. Obviously, you can call me at any time, but Colleen's really a great point person for that. But this year, as we're looking at insurance, we took a big step to add a life insurance policy that Colleen will talk about. And Colleen will explain to you the benefit that comes with that, called the EAP plan, which has a lot of benefits that I think will be helpful and fruitful. So as we roll into that, both of those are new things for this year. And many of you have asked about a 401k plan of some sort. We're not doing that right now, but Jamie and I and Colleen have been talking about what that might look like in the near future. So kind of keep your ears open for that. But that might be something you see coming. I know this year particularly, we've talked to a lot of caregivers that are maybe a little confused as to how this insurance works with regards to employment with Aker Kasten. And I just wanted to take a moment to explain how that works so that we're all on the same page as far as expectations and then processes going forward. As an employee of Aker Kasten, you come on as a variable hour employee. Whether you've been working full-time for 48 years or you are intending to work 84 hours a week with us, you are considered a variable hour employee. Because your case may be full-time today, but tomorrow it may not exist, whether the client passes away or there's some change in the schedule or something. So because you're variable hour, at the day of employment, we can't guarantee that you're going to be full-time, therefore we can't extend benefits to you. So what we do is measure your work for 12 months. You who have been with a company for some time know that this is how we work it. So the first 12 months of your work, we are tracking on a monthly basis how many hours you are working to see if after 12 months you are full-time. That same process of measuring goes forward for every 12-month cycle after that around the benefit recycling year. So we are always tracking to make sure that you are continuing to work at a full-time status. This year, we had an employee that, at least one employee that had been full-time in the past, but because not enough shifts were worked during the year, they actually fell out of eligibility. So just wanted to make you aware of that just because you have been full-time in the past doesn't necessarily mean that you will continue to be full-time forever. The idea of a benefit plan is to encourage you to stay connected and loyal to the company as we're trying to provide hours for you. So bear that in mind as you go forward. So if you start today and you work 12 months and you are full-time and you do choose to come on the benefits plan, you want to make sure that you're continuing to take hours going forward so you can continue to be eligible for the plan going forward, because it's not necessarily a given. We're required by certain laws to provide insurance for those that are working with us, but if you're not taking hours, you might lose your eligibility. Just don't want you to be aware of that. Once you do come on the insurance plan, the premiums for whatever plan you take, whether it's medical, dental, vision, or any other additional uh, insurance coverage, the premiums are your responsibility. Now, let me say that again. Your portion of the premiums are your responsibility. They come out of your paycheck. And just remember that even though you're paying a small portion for those premiums on a regular basis for every time pay period, the company is paying, in most cases, a lot more than you are for your benefits. So that's a benefit we're giving back to you. But I say that just to remind you that just because you may miss a pay period doesn't mean that somebody is not paying for your insurance. We're paying for it. That's why we're trying to collect back those premiums for you. So if you're on the plan, make sure that you're working consistently and getting a paycheck. For you who have been with us and been on the plan, you know that our policy is that if you're on the plan, you need to continue working. If there is a period of 30 days where you don't take any work from us, we consider you ineligible, or excuse me, inactive. In part of the system, you're considered terminated. As far as insurance goes, you are considered ineligible and your insurance will run out at the end of the month. So it's important for you to continue working. And remember that even if you're not working, you are still responsible for your part of the premium. In years past, what we have tried to do is grab a missed premium on the following pay period when there's work. This year, we're going to change that. When you sign up for insurance this year, we are going to take a copy of your credit card when you sign up, so that if you miss a premium through the course of the year, we are going to charge the credit card for your missed premium rather than waiting and trying to collect it later. The process has become very confusing. And also, it's good for you to remember that those premiums are still your responsibility. I don't want Aker Kasten to be stuck because we're not able to get a process together. So that's going to be a slight change in the way that we manage it this year. If you are continuing to work, you'll continue to be eligible, and we want you to have the benefit. And I throw out some of these rules that sound like I'm being a little bit controlling, but the reality is we want to give as much benefit to the employees of Aker Kasten. And so our encouragement to you is to continue working. We'll figure out ways to continue to pay for your premium. I'm trying to communicate as best as I can, as consistently as I can with those that are either losing hours or who are no longer eligible. And on the other side, I'm sending out text, emails, and phone calls to those who are coming on eligibility, because that's happening on a monthly basis as well. So if you have questions along the way, you can always call me with regards to the processes of payroll and premium deductions and things like that. If you have going forward questions about the actual benefits or how to handle a doctor or handle some situation, insurance cards, those types of things, Colleen's a great partner with you on that. So I am sure there are other questions that will pop up along the way with regards to your relationship with us. You can always call me, you can always email me, you can always text me. Never a problem at all. And just please know that we are trying to do right by you. And we really want to have a great relationship with you. So we're glad you're with us, and hope it's a great benefit year.
Thank you, Matthew.
Thanks, Colleen.
And we appreciate your partnership as always. So, with that being said, let's take a deep dive into these benefits. There have been some changes this year, including a change in your health insurance carrier. In past years, we've been with Blue Cross Blue Shield. This year, we will be moving to Aetna. We'll talk about the Aetna benefits coming up in just a couple of moments. Also, a brand new benefit is the employer paid life insurance, as Matthew had mentioned, which also includes a brand new employee assistance program. As a reminder to everybody, though, the benefits that you choose, you are locked into for the given plan year. That means whatever plans you choose, you will remain on through April 30th, 2022, unless you experience a life-changing event. Life-changing events are going to include, but are not limited to, if you get married, you can bring a spouse onto your plan. If you get divorced, you can remove a spouse from your plan. if your spouse loses coverage at their place of employment, they can come on your plan. Again, all of these types of changes will allow you to bring a dependent on the plan. However, you cannot change your plan still. So it is important that you understand all of your benefits, and I am here should you have any questions. Also, if you do experience a life-changing event, it is very important that you notify us within 30 days of the event. This would also include if you become eligible for Medicare and wish to come off of the group benefits. Taking a look at the bottom of the first page, you're going to find a review on how you can search for participating providers. As I mentioned earlier, we are switching to Aetna, so I do advise everybody to take a moment and just confirm whether or not your doctor is within the network prior to seeing your doctor. Also on the right-hand side of the page is going to be a review on how you can locate a participating dental provider. There are two different networks, the PPO and the DHMO, and we will talk about the benefits on the next page. Without further ado, here is a look at your Aetna benefit options. Every employee is going to have the choice of 4 different Aetna plans. Each of these Aetna plans all utilize the exact same network. It is the Elect Choice EPO Open Access Network. Again, on the bottom of the first page is going to be step-by-step instructions on how you can locate a provider within that network. So if your doctor is on the plan in column 1 over here, that means that your doctor is in all of the plans. The first plan we're going to talk about is the OA EPO 7200 100% INT plan. On this plan, they very copay rich. You have copays for a primary care doctor, $35, and a specialist, you have a $100 copay. I do want to point out that CVS Minute Clinic. So if you're not feeling well and you go to a CVS Minute Clinic inside of a CVS pharmacy or inside of a Target, you are able to be seen at no cost to you. That's whether you're sick, maybe a pink eye, a head cold, you can walk in, walk out, and not have to pay anything. In addition, all preventative services are covered at no cost to you, regardless of the plan you elect. The 7200 plan does have an emergency room copay after you satisfy your deductible. However, the urgent care has a $75 copay, no deductible required. That means you walk in, you walk out, you pay the $75. Lab work, x-ray, advanced imaging, and outpatient hospital, so outpatient surgery, you are responsible for 100% the contracted rate until you satisfy your deductible. Once you satisfy your deductible, those services will be covered at 100%. After you satisfy your deductible, you will have a copay of $500 for inpatient hospital services and a $300 copay for your emergency room services, again, after you satisfy your deductible. This line right here is your out-of-pocket maximum. This is your end-all, be-all, worst-case scenario. This dollar amount right here, $7,800 for an individual, not to exceed $15,600 for a family, is going to include your copays, your deductible, and your prescription drugs. Everything is in there. Once you reach this dollar amount within a given calendar year, all of your care and treatment within the network will be covered at no cost to you. Speaking of prescriptions, we have a big change coming this year. The 72 100% plan has a copay of $10 for any generic medications, and now will also include brand name drug coverage unlike your former Blue Cross Blue Shield plan. If you need any brand name drugs, you will once again have to satisfy the deductible of $7,200 for an individual, and then you'll have the copay associated with each of the different tiers. So $50 after the deductible for preferred brand, $80 after the deductible for non-preferred brand, and then any specialty medication is going to either be $250 or $400 again after you satisfy that deductible. Next plan we're going to talk about is the 5,100% INT plan. Plan's going to work very similar to your first plan option, the 7,200. You're just going to have different copay amounts. Also, your deductible is going to be slightly lower. However, you will notice that your out-of-pocket maximum is exactly the same. This is, again, your end-all, be-all, worst-case scenario. Prescription drugs on this plan, again, exactly like the first plan where you have to first meet your deductible prior to having a copay for any brand name medication. Generic drugs, straight copay, no deductible responsibility. The third plan option is going to be the OAEP 5,100% plan. I do want everyone to please be very careful when electing the plans online, because you'll notice that the plan names are almost identical, but the benefits are very different. So the plan in column 2 over here has INT at the end. The third plan does not. So please just, again, take a second, make sure you picked the correct plan when making your elections. This plan is very copay rich. In addition to having the copay for the primary, the specialist, and the urgent care, you're going to gain a couple additional copays, including a $60 copay for an x-ray and a $500 copay for any advanced imaging, which covers MRIs, CAT scans, PET scans. Emergency room and both inpatient and outpatient services are going to require you first to satisfy your deductible before that copay kicks in. Plan, again, has a $5,000 deductible for an individual, not to exceed $10,000 for your family. In addition to that, you're going to have your out-of-pocket expenses, $7,350 for an individual, up to $14,700 for the family. Out-of-pocket, again, includes deductible, copays, and prescription drugs. As we scroll down to the bottom of the page to look at the prescription drugs, you will notice that regardless of the tier of the medication, you are going to have a copay, not necessary for you to meet your deductible on any of the covered prescription plans or covered prescription medications. The last plan option is going to be the OA EPO 4,100% plan. This plan is going to work very similarly to the third plan that we just spoke about, the OAEP 5,100% plan. It's going to be very copay rich. You have the copays for the doctor, the specialist, the urgent care, the x-ray, and the advanced imaging. And you're going to have deductible and then copay for the hospital-based services such as emergency room, inpatient, and outpatient surgery. Deductible is $4,000 for an individual, not to exceed $8,000 for a family. Out-of-pocket maximum, $6,500 for an individual, $13,000 for a family. As we scroll down, you'll notice that the medication, again, they are straight copays. Nothing is subject to deductible, straight copay. Couple of things about the plans in general. None of the plans have out-of-network benefits. What that means is you have to remain within the Aetna network in order to receive coverage, except in an emergency situation. In an emergency situation, regardless of the plan that you need, you will be covered as if you were in network, and that would fall under your emergency room copay. The dollar amount you're responsible for is going to depend upon the plan that you elect. Another thing that I just wanted to reiterate is that your preventative services regardless of where you seek them. If you go to a primary care doctor for your well child or your annual physical, if you go to an OB/GYN for your well woman, if you go to a gastro for your um, preventative colonoscopy, all of that is covered at no cost to you. Also, if you are sick and need to see a doctor, you do have the option of going to CVS Minute Clinic, meeting with a nurse practitioner, and getting a prescription sent over to the pharmacy, and your visit with that nurse practitioner is covered at no cost to you. Next thing I wanted to talk about is just some ways to help save on prescription medications. Walmart, Winn-Dixie, they have a list of medications that are going to be $4 for a 30-day supply or $10 for a 90-day supply. You do not need any insurance in order to qualify for that program. It is through the pharmacy. Also, Publix has free routine maintenance medication and free antibiotics. Again, no prescription coverage is needed. I did also want to take a second and just talk about GoodRx, which is it's a website that will allow people to go online, type in the name of the medication that they're currently taking, and if there's a coupon, the link to the manufacturer coupon will come right up. Great, especially if you are taking a medication that does require deductible, which would be any brand name medication on the first two plans, if you so choose, the plans that end in INT. Another thing I did want to mention is just the use of CVS. CVS is going to be an Aetna-owned pharmacy, so you're going to see some more discounts, some more value at the Aetna pharmacy, including being able to get 90-day supply. Next page just talks a little bit about the Aetna website itself. On the Aetna website, you're able to locate in-network provider. You're able to download your explanation of benefits. You're able to utilize their cost savings tool where you can type in a procedure that you need, type in your zip code, and it'll pull up places in the area and tell you what the contracted rate is. That's going to be great, especially on services that are subject to the deductible before there's any cost share. Once you are enrolled in Aetna is when you're able to enroll in the Aetna site. So you cannot go to Aetna.com and register right now. We have to wait until May 1st to do so. Next is just a little bit of information on your Aetna ID card, how you can access in the Aetna member portal, and steps for if you forgot your username or password. Page 6 talks a little bit more about the Minute Clinic, which we did speak about, how CVS Minute Clinic, you're able to get care and treatment at no cost to you. They are open 7 days a week, including evenings and weekends. The next benefit is the Aetna Attain benefit. This benefit is available to you regardless of the Aetna medical plan that you enroll in. This benefit allows you to purchase an Apple Watch for as little as nothing. There are certain like buy-up upgrades that you could purchase, and therefore you would be responsible for a smaller dollar amount monthly, but essentially Aetna is giving you an Apple Watch for free. What happens is you have to download the app. You're going to purchase the Apple Watch through the application, and then as long as you meet your monthly goals, they are going to make a monthly payment for the Apple Watch on your behalf. The cost of the Apple Watch is going to be split into 24 equal monthly payments. Again, it's only certain Apple Watches that are covered at no cost to you. If you elect to buy up, and it will make the payment for the Apple Watch, and you'll just be responsible for the difference between the free one and the Apple Watch that you did so choose. If you do not meet your wellness goal for that month, that's okay. That means you're going to be responsible for the Apple Watch payment for that month only. But you get back on track the following month and you meet your goals, and then Aetna will start paying again. Next page talks about how you are able to earn up to a $50 credit to use towards your deductible. You do need to go to Aetna.com and take your health assessment, and you're going to do a online health coaching program. Again, about maybe 10, 20 minutes depending, and you're able to get a $50 credit for your plan. Next, we're going to talk about your dental benefits. There has been no change to your dental plan, your dental network, nothing. So if you are happy with the plan you are currently enrolled in, it is still an option. However, I am pleased to announce that the rates for the dental have gone down this year. Two different dental plans to choose from. The first plan we're going to discuss is the DHMO plan. On this plan, you must pick a dentist and see that dentist. You do have the option of changing your dentist at any point in time, but you must call Guardian prior to seeing that new dentist in order for the visit to be covered. On this plan, there is a copay for each and every single covered service, including orthodontia for both children and adults. The next plan option you have to choose from is a PPO plan. The PPO plan has, number one, a larger network of in-network dentists to choose from, plus you have the ability to go out of network if you do so choose. You are going to receive a better benefit within the network, but again, you do have the option to go out of network if you do so choose. This plan, there's a $50 individual deductible for any basic and major services, and it's not to exceed $150 collectively for your family. Then Guardian is going to pay $1,000 on your behalf for each and every single covered dependent. Please keep in mind that while you may only enroll on the medical plan, you can choose to cover your spouse or your children on the dental or the vision. It can mix and match. It doesn't have to all be the same as your medical election, so you can pick and choose who you want to cover on each of the different products. Preventative services within the network covered at no charge to you. Basic services such as your filling is going to be 20% after you meet your deductible. Major services including extractions, periodontal scaling and root planting, root canals, crowns, dentures are covered 50% after your deductible. Please keep in mind though that Guardian is only going to pay $1,000 for you every single calendar year. If you exceed $1,000, then you are going to be responsible for the total charge. However, you are still getting a discounted rate for having the Guardian plan. Out of network, again, you have coverage if you do so choose. You are going to be responsible for more, and that $1,000 is going to be a combination of both in-network and out-of-network. With your calendar year benefits, it had restarted itself in January. So if you are currently on the PPO plan and you have already seen the dentist in 2021, you may not have $1,000 available to you today. However, January 1st, 2022, you will automatically replenish and have another $1,000 available to you. Next is the college tuition benefit, which is included in either of the dental plans. you'll have the option of the dental, PPO, or DHMO, both coming with the college tuition benefit. You do need to enroll in this separate website, which is www.guardian.collegetuitionbenefit.com, in order to register for the program. Then each and every year that you are enrolled in the dental, you are going to receive 2,000 tuition reward points, which actually equates to $2,000. This money can be used towards the future college tuition of a beneficiary. Beneficiaries are going to include children, grandchildren, nieces, nephews, godchildren. So as long as you have the name, date of birth, and address for the child, you are able to register them as your dependent. In addition to the 2,000 annual points that you're given, you also get an additional 500 bonus points for each dependent that you enroll. You must enroll in the website within 6 months of your plan date in order to get the points for this year. So please do not delay. Next benefit we're going to talk about is the accident benefit offered to you through Guardian. Exact same benefit as last year, exact same pricing. With this benefit, Guardian is going to pay you in the event that you are injured in an accident outside of work. The dollar amount that you receive is going to depend upon, number one, the type of injury that you sustain, and number two, where you seek care and treatment. In addition to paying you if you are injured due to an accident, there's also a $50 wellness benefit that you have. That means is if you go to the doctor and you have your annual wellness visit, which will cost you nothing with your Aetna insurance, you are able to complete a claim form and get $50 back from Guardian, in addition to having all of the other benefits available to you. That's just a nice little perk. Next page, we talk about the vision plan. Vision is exactly the same as it is last year, so if you're happy with it, you have the option to keep it. Middle of the page talks about how you can locate a participating provider. Please note that you will choose the Davis Vision Network. You then have a $10 copay in network for an eye exam. If during that eye exam it is determined that you need corrective lenses, you have a $25 copay for lenses for your glasses, and you are given a $130 retail allowance towards the purchase of frames. If your frames cost more than that, you're given a 20% discount off the balance over that $130 allowance. There is no additional discount at Walmart or Sam's Club, though, because they're already so deeply discounted. However, there is an extra $50 allowance if you purchase your frames at VisionWorks. So instead of the $130 allowance, Guardian will give you $180 at VisionWorks towards the purchase of your frame. If you choose to purchase contact lenses instead of frames, you're given a $130 allowance, then 15% off the balance. Again, please keep in mind that there is no additional discount at Walmart and Sam's. Should you need contact lenses which are deemed medically necessary, which is very highly unlikely, but if you do, it is covered in full. You do have the option of going out of network. However, you are going to pay 100% for the cost of the claim. You will then need to complete a claim form, submit supporting documentation of your payment, and then you'll get reimbursed up to the allowable amount. You are able to get an eye exam every single year, contact lenses every single year, and new frames every other year. The next benefit we're talking about is a critical illness benefit. This, again, is a benefit through Guardian that will pay you directly. The benefit is going to pay you in the event that you are diagnosed with a critical illness, including heart attack, heart disease, cancer, organ failure, kidney failure. The dollar amount that you get is going to depend upon the critical illness that you are diagnosed with. The maximum that you can get is $10,000 for yourself and $5,000 for your spouse and your children. It is a $2,500 maximum benefit. Please note that if you elect coverage for yourself, please make sure that you enroll all of your dependent children under the age of 26 because they are covered at no additional cost. Whatever you pay for your own coverage is what you will pay for your children. Did want to just make note that there is a pre-existing condition exclusion. What that means is any pre-existing condition that was diagnosed or treated within 3 months prior to you purchasing the policy will not be covered for the next 12 months. However, on that 13th month, if something should happen from a pre-existing condition, it will be covered. The pricing for this benefit is going to vary depending upon the dollar amount that you elect and your age, so Employee Navigator will have that information. Finally, we are talking about one of your brand new benefits, which is an employee assistance program. What an employee assistance program is, it is essentially a benefit to help with any type of issue that could come up that's going to affect your productivity, your health, your mental and emotional well-being. So there is unlimited telephonic and online support that can help with a variety of different topics, including help you build a budget, help you plan for retirement, maybe help you plan for that Europe trip that you've been dying to take. Maybe you are caring for your aging parent and you need help looking for an assisted living facility, or if you're looking for an adult daycare, or they can help with immigration questions, a whole wide variety of topics. In addition to unlimited telephonic and online support, they also provide you with 3 free face-to-face sessions with a licensed counselor free of charge. I know especially right now with the situation the world is in with this unfortunate pandemic, a lot more people are feeling blue. We're affected by loss, and it is nice to just be able to talk to somebody else. Please know that if you use this benefit, I will not know about it. Matthew will not know about it. It is 100% confidential. I will not know who calls. I will not know any topic that is discussed at all. So please reach out and take advantage of this program. Next benefit we're going to talk about is your brand new life insurance. Each and every eligible member is going to receive a life insurance benefit, which is equal to 1 times your annual salary, which is going to be determined based upon your W-2 income from the preceding calendar year, not to exceed $200,000. Please note, though, anybody over age 65 will see a reduction in the benefit. This, again, is provided to you at no cost. Your employer is paying for this for you. The last thing that we're going to really touch upon is going to be the online enrollment. Everybody is required to either enroll or decline their benefits online at employeenavigator.com. Many of you are going to be returning users. If you were eligible for benefits in the past and you have already logged in and created your user ID and password, you are considered a returning user. We've always suggested using your email address as the username. However, you were free to choose whatever you wanted. So if you do not recall what your username is, please feel free to reach out to me. If you forgot your password, you're going to click on the Forgot Password link, and you'll get an email with a link to reset your password. Brand new employees that are eligible for the first time or have never used the Employee Navigator system, they will follow the instructions at the top. You're going to go to employeenavigator.com. You're going to click log in. You're going to register as a new user. It's going to ask you for your first name, last four digits of your social, your date of birth, and your company identifier. Your company identifier is right here in red, Aker Kasten Home Health. Please note it is case sensitive, capital A, capital K, capital H, capital H. And then the very last thing that we are discussing is going to be the contact. Doesn't matter if you know the answer as long as you know where to find it. The contact information on the back page bottom is going to provide you with the name of each of your carriers and the telephone number or website for your different providers. In addition, you have contact information for both myself, Colleen Hernandez, my telephone number, and my email address, as well as Debbie Rita. Please do not hesitate to reach out with any questions or concerns that you may have. We are here to help. I thank you all for your time, and I hope you have a great day. Thank you.